Welcome to VoAC Chat. VoAC Chat is where we highlight the programs, services, and the dedicated staff of Volunteers of America Chesapeake and the Carolinas. We take you on an up-close and personal journey as we strive to fulfill our mission of empowering self-reliance and inspiring hope.
The scripture I selected for this month is Mark 11:24. Therefore I tell you, whatever you ask in prayer, believe that you have received it, and it will be yours. I'm here on location with Arnetta Legree, who is the Senior Director of our DC Core Behavioral Health Program. Thank you, Arnetta, for making time today. So how long have you been with Volunteers of America now?
I have been with VoA 13 years.
13 years. And before that, I understand you're a veteran.
But I am a veteran. I was stationed at Walter Reed Army Medical Center. And I was actually at Walter Reed during 9/11. So.
Oh, is that right? Mm-hmm. I remember when we first met, you were in the basement of an apartment building off of New Hampshire Avenue in Northwest, and literally it was not any bigger than his office here.
That's correct.
So what contributed to that growth during the last 10 years in really building out an incredible program?
Really, I owe our success to our team. We have people who definitely believe in the mission. Of course, yourself, Candace, our VP, everybody kind of worked together to ensure that we were successful.
Talk a little bit about what services you provide and what core services agencies do in the District of Columbia.
Okay. Since 2006, we're licensed through the District of Columbia Department of Behavioral Health. We provide community support, counseling, medications, diagnostic assessments. Since we started, we've added day rehab, we've added level 1 substance abuse, and we recently started providing supported employment services. Of course, we do the mental health, but we also have a lot of add-on service where we help consumers with food. While we don't have housing here, we help our consumers connect with housing. Yeah. Within the last 60 days, Kim Bodie, our community support housing person, was able to get 4 people into housing.
Oh, that's fantastic.
As far as benefits, we have Ms. Wilson, who is our community support benefits person. She was able to get 6 people. Basically, we save consumers' lives, and that's not just something that we say. We actually do.
In the population you're serving now, out of the 1,000, you really are taking a bilingual approach and making services available here in Northwest.
All of the services that we provide, we actually offer them in Spanish as well.
And a lot of your population is homeless.
But we have a lot of consumers who are, we call them consumers, our population who are homeless. We have a lot of our consumers who are single. We have a lot of our consumers who VOA is their only next of kin.
You've been talking around consumers, and we hear the vernacular within our organization. Why consumers in the agency here?
That's a term that the District of Columbia Behavioral Health uses. And the idea behind it is that consumers, that these are people who have a right to say what they want and what they don't want. They have a right to say what they like and what they don't like. So that's the term, hence the term consumers.
It's that independence, it's that free choice. So this is an outpatient clinic.
DC calls it a core service agency, which is an outpatient mental health clinic or behavioral health clinic. I like to say it's an outpatient behavioral health clinic with steroids, meaning it's not just the mental health piece, we provide those other services.
Now, turning that to healthy homes. What's happening in healthy homes is basically care coordination for the individuals that come through the core service agency and then go home to actually receive their care.
Right, exactly. Because consumers with who are diagnosed with a mental illness die much earlier than the regular population. So VOA, this agency, we decided to become a health home provider. When our consumers come in, they get that extra support. They get that extra nursing support. They get that extra support when we're calling people, making appointments for them, things of that nature.
How many core service agencies are there here in the District of Columbia?
I would say at this point, probably about 20, 25.
About 20, 25. It must be an incredible number out there of men and women that need the services that the DC Core Service agencies provide.
When we look at mental illnesses, when we look at severe and persistent mental illnesses, there is definitely a need, and we definitely do serve that.
So you are shooting for Program of the Year, it sounds like.
Well, yeah, definitely. But definitely, I owe it all to our staff. I think our team, we really work hard. If there is an issue, a consumer has a problem late at night, our team doesn't mind going to visit the consumer, doesn't mind going to just being there.
3 or 4 years ahead, what would you say would be success for DC Core Service?
I think for success, what we're looking at is starting a store. We're looking at starting a business for our consumers.
Yeah.
We're making some phone calls, putting together some paperwork to present to you and the board. So remember that.
Program of the year and then program growth of the year.
Yeah,
That's
right.
what we're hearing right here today.
Right,
So
yeah.
you heard it here first. From the basement of an apartment building to a larger office than the admin office. Congratulations, Arnetta Legree.
This month, Volunteers of America Chesapeake and Carolinas recognize the contributions made and the important presence of Hispanic and Latino Americans to the United States and celebrate their heritage and culture. We celebrate their rich and vibrant traditions that reflect the multi-ethnic and multicultural customs of their community. And we celebrate the Hispanic and Latino America staff of VoAC and their strong commitment to family, faith, hard work, and service.
Thank you for joining us for VOA Chat. We look forward to bringing you more exciting things going on in both Volunteers America Chesapeake and also the Carolinas. Be sure to like us on Facebook, follow us on Twitter, and visit our website at www.voachesapeake.org.